Good afternoon, and welcome to our next panel discussion as a part of the 2020 Missouri Public Transit Conference, Transit's on Track to Impact Climate Change. I do hope that you had a chance to join us at the last workshop on mindfulness, and you've taken a deep breath and you're ready to go for this afternoon. This panel will be centered on climate change and transit. Mobility is essential to the growth of our communities, but moving people from place to place can exact a steep price. Transit is on track to make an impact on climate change with the move to electric vehicles. While these changes take time, this panel will discuss the public health benefit of making that transition. I'd like to welcome our moderator, John Hickey, the Missouri State Coordinator for Clean Energy for Biden. John, I'm going to turn it over to you to introduce your other panelists and kick off this really important talk. But as a reminder to our audience, if you have a question, please place your question in the chat box and we will get to those as quickly as possible. Thank you again for joining us. And John, I'm going to turn it over to you.
Okay, well, thank you, Kim, and thanks to Citizens for Modern Transit for hosting the conference this year. And I also want to thank all the public transit professionals who are part of this workshop, because you are providing critical support and services to the public, especially at this time of the pandemic where people need to be able to get to work, get to a job. And thanks to all the transit agency staff and bus drivers and mechanics who are helping make that happen. And we've got a really interesting panel for this session. Let me introduce my other panelists. Dr. Christine Ekenga is a professor at Washington University at the Brown School, and she is going to be talking about a study that she did looking at the differential health impacts of air pollution within the city of St. Louis based on race and income. So that's going to be very interesting and relevant to transit professionals, because of the city of St. Louis in our region is going to be an area with the greatest density of bus lines and bus traffic. And we also have Dr. Raymond Slavin, who's associated with St. Louis University, who runs an asthma clinic in North St. Louis. So he is on the front lines of seeing the actual impact of air pollution on people, and he will talk about what he's seeing in his clinic on North Kings Highway. So Drs. Ekenga and Slavin will be talking about the public health impact. I'm more the generalist. I'm just going to give a general overview of how transit options impact public health and impact climate. So with no further ado, let me share my screen. And there we go. So the title of this session is Transit's on Track to Impact Climate Change. We could actually have called it Transit is on Track to Impact Climate Change and Public Health. And let me explain why that is. And let me start off with, if anything I say, if anybody's interested in follow-up, that's my contact information right there on the screen. I think the agenda is what we just went over. But if you look at the sources of greenhouse gas pollution in the United States of America today, and this is 2018 data, you'll see that the biggest source is the transportation sector. That is even bigger than the electricity sector. And this is a new development. If you'd gone back a few years ago, electricity would have been the biggest sector. But what we're seeing is a real change in the electricity generation sector where coal-fired power plants are being retired and cleaner sources are coming online, energy efficiency, wind, solar. And if you just look across the state of Missouri, you'll see the Asbury plant, coal plant near Joplin is retired. The James River plant in Springfield, Missouri is retired. The Sibley and Montrose plants near Kansas City are shut. The Chimoy plant and the Columbia municipal plant in mid-Missouri have closed down. And these are all within the last 5 years or so. So as electricity is reducing its carbon impact, the transportation sector has become the biggest source of greenhouse gas pollution. And so that's where transit comes in, is while transit is obviously just one part of the overall transportation pie, it is a important part. And if you want to quantify the impact of air pollution, a gentleman named Drew Schindel, who's a professor at Duke University and was one of the co-authors of the Intergovernmental Panel on Climate Change report for the United States, and speaking to Congress recently, estimates that there are 250,000 premature deaths a year in the United States caused by air pollution. So that's a lot of people. If you look at it, if you divide it up by state, and let's say it's even by the 50 states, you're talking 5,000 premature deaths a year in the state of Missouri. But that's the bad news. The good news is that aggressive decarbonization could reduce that toll by 40% within a decade. So because a lot of sources of air pollution aren't in the air for a long time, if you clean up the source, you fairly quickly get big public health benefits. And so that is the good news. Dr. Schindel estimates over 20 years, it could save 1.4 million American lives who would otherwise be lost to air quality. So big picture is air pollution has a major impact. And here we're talking air pollution from all sources. We're not just talking transportation. We're not just talking public transit. But if we wanted to drill down a little closer, and if we looked at transportation from diesel engines, then this slide gives you some more data on that. The most deadly part of air pollution is something called PM 2.5. PM stands for particulate matter, and 2.5 indicates that it's a diameter of 2.5 microns or less. So these are the small particles that are so small you can't see them. It's not I know when I drive into St. Louis from the Illinois side, sometimes I see a big brown haze over St. Louis as I come over the bridge. That is not PM 2.5 because I can see it. Those are larger particles. And they're actually not as dangerous because you don't breathe those particles so deeply into your lungs. And it's those very small particles that go into your lungs and stay there for the rest of your life. Diesel particulate matter includes these small particles. And I looked at some data from the California Air Resources Board that estimates in California that diesel particulate matter is responsible for about 8% of the PM 2.5 in outdoor air. So takeaway here is diesel is not the majority of the creating the problem, but it is a significant slice of the overall PM 2.5 problem. And of course, other contributors are going to be gasoline engines, coal-fired power plants, industrial processes, et cetera. Let's now take it and get even more granular. Let's look at what is the impact of one electric bus on emissions. And this is from a fact sheet that came out about a year ago from the Chicago Transit Authority, where their estimate was operating one electric bus per year is the equivalent of removing 23 cars from the road, because obviously buses are bigger than cars and they run a higher percentage of the time. But that reduction, the reduction in emissions from that one bus would reduce the incidence of illnesses and respiratory diseases at a value of $55,000 a year in terms of health impact. Or over the course of a 12-year bus lifespan, that's $660,000. And you may be sitting there in front of your computer on this Zoom call thinking, how in God's creation did they come up with that number? Well, actually, you can do that too. There's a calculator on the Environmental Protection Agency's website called the Diesel Emissions Quantifier Health Benefits Methodology. So that kind of rolls off your tongue. But you can go use that tool and estimate what an electric bus would mean for your community. It will be different. It'll depend on what is the density of housing where your buses run. What is the wind speed? What is the how often are you running your buses? All that stuff. But when you look at the savings per bus, while that $55,000 health cost isn't part of the budget for your transit agency, it is part of the larger budget for your metro area. So it's something that you need to keep in mind. Now, to a certain degree, I'm preaching to the choir here. I know a number of transit agencies in Missouri are already adopting electric buses. And this is just my understanding, and I'd encourage people in the Q&A section, if we are underestimating your commitment to electric buses, please update us. But I know the bi-state here in St. Louis, a number of months ago, decided to purchase 14 electric buses with the goal of deploying them in early 2021. Kansas City Area Transit Authority has got 2 electric buses on order. Kansas City Airport is moving to all electric shuttle buses at their facility. City of Columbia reported that 30% of their current peak service is provided by electric buses currently. And the city of Springfield has got a couple electric buses on order that are to be delivered at the end of the year. So we're seeing movement. We still have a way to go. I know bi-state has, last time I checked, 408 transit buses. So 14 buses is a start, but the difference between those numbers gives you a sense of the scale of what we need to build up to really electrify the fleet. Now you may be thinking, boy, John, you're putting a pretty big load on us. How are we supposed to get all this done? It's very expensive. It's new technology. It requires new infrastructure. The good thing is there's a number of entities that want to partner with you. what I have found is investor-owned utilities in Missouri, some of the biggest are Ameren and Evergy, want to help you move to electric vehicles because those utilities are facing a crisis of slowing load growth, and they want to look for ways to sell more electricity. And if they can help you transition to electric buses, that's good for their business as well. And so they're supportive. Columbia and Springfield, of course, have municipal utilities that sell electricity. They are going to be keen to sell electricity to the buses instead of the city buying diesel and sending that money out of town. The public health sector is an ally, and you'll learn more of that from Dr. Ekenga and Dr. Slavin. Obviously, environmental organizations that care about clean air and climate are allies. I know several of the transit agencies here in Missouri have gotten support letters from environmental organizations when they've sent in grant proposals to the federal government to raise money to buy electric buses, for example. And city governments are often supportive because they want to protect the public health of their citizens and promote clean air in their municipality. Now, you may be thinking, okay, it makes sense in terms of climate, it makes sense in terms of public health, but the public just doesn't get it. They're not gonna put up with this change. And so I looked at some data that's less than a week old from the Yale Climate Opinion Map that looks at what people think across the country about is global warming real or not. And even in Missouri, the number that they've come up with is 67% of Missouri adults think that global warming is happening. So 2 out of 3, and that's a pretty high level of agreement. And if you drill down to the regional level, you might think, okay, well, that's great. That's St. Louis, but I'm in Springfield, I'm in Joplin, I'm in Salem. People don't think the same here. Well, this Yale map actually breaks down these numbers down to the county level. And I just looked at the congressional district level this morning. If you look at congressional district, at the 8 districts in the state of Missouri, the district that had the most skepticism still had 63% of the adults there believe that global warming is happening. So this Missourians across the state, a substantial majority understand that this is a real issue. And I'm gonna end with this slide. This is folks from Bi-State are gonna recognize this. This is the Brentwood Bus Garage, taken from the southern side. And you see in front of you a brown lattice work fence in the foreground, and the bus garage is in the background. What that is a new electric substation that Ameren has built to be able to support electric buses at that bus garage, because you need to build that substantial infrastructure to be able to have electric buses, because you need to be able to plug them in and you need to be able to have a secure electric supply. But Ameren was actually very keen to participate in this project. And as you can see, it's now just about ready to go and ready for those 14 buses to come at the end of the year and start plugging in. So, so that is my presentation, and I'm gonna then throw it back to Dr. Ekenga to share her insights.
Well, thank you, John, and thanks to the organizers for having me. Are you all able to see my slides?
Yes.
Yes, great. Okay, so I wanted to give a brief overview of our study that we did last year looking at air toxics in the St. Louis metropolitan area. And so for those of you who aren't familiar with the metro area, the St. Louis is a metro area is a 15 county region, about 3 million residents, and 75% of residents reside on the Missouri side of the area. In terms of the demographics of the population, 76% of the residents are white, 18% are African American, 3% Asian and Hispanic. And our education and income levels are very similar to the national average, and our poverty levels are just a little bit below the national average. So here we're looking at the geographic distribution of some characteristics of the St. Louis metro area. And you'll see that most of our non-white population is clustered around the center city of St. Louis. Whereas if we're looking at poverty, there are pockets of poverty, unfortunately, clustered throughout the region. And so our interest in looking for air toxics, let me take a step back here, is I had been working at Washington University, working with community groups, and there were long-standing community concerns, both about cancer in the region and about environmental health hazards in the region. And so on the right is some data from St. Louis County, the largest county in the region, and there are income and racial disparities in both cancer incidence and mortality in the region. A couple of years ago, we conducted a study with low-income residents in the region, and we asked them about what were their major environmental concerns in the region. And the top 4 concerns are on the bottom there: air quality, flooding, neighborhood safety, and access to healthy food. So as a result of what we saw from the study of environmental concerns, we decided to first look at air quality in the region. And John touched on this before, but there are a variety of health effects that are associated with air pollution. Some of the acute effects include irritation of the eyes, nose, and throat, wheezing, and cough, but more of the effects associated with chronic long-term exposures. We've seen associations between air pollution and heart disease, and some lung disease, and some cancers as well. So the title of the talk is looking at air toxics, and I just wanted to give a brief definition of what I mean by air toxics. And this is actually defined by the EPA. These are pollutants that may cause cancer or other serious health effects. They may cause adverse human health effects and also adverse environmental effects. They have a wide variety of physical and chemical characteristics, but some of these toxicants, they can persist in the environment and what we call bioaccumulate over time. So over time, they can become more toxic. So in our study of the St. Louis metro area, we looked at EPA data, and we looked at the EPA National Air Toxics Assessment. And this is publicly available data published on their website, looking at air toxics across the nation. And so they published data on over 140 hazardous air toxics, and they're looking at the sources of these toxics. So relevant to the title of this panel, they were looking at mobile sources in addition to point, non-point sources and other sources. So they provide for each census tract in the US, they provide an estimate of exposure to these air toxics. And they published this data, and this is a quote from their website. They want the public to get a better understanding of the air toxics problem in the US and in their communities. So with our study, we were looking at the relationship between the neighborhood characteristics in the St. Louis area and exposure to these air toxics. And what we did was we linked census data to the EPA National Air Toxics data. And so some of the census data we were looking at were income levels, race and ethnicity, employment status, education, and also the type of housing, and counties and different levels at the census tract level. So we ended up mapping the EPA data. And what we did was we wanted to identify what we called hotspots. So areas where there were higher than expected concentrations of air toxics, and cold spots. And so on the left here is the entire region. And you can see that unfortunately, most of the hotspots are around the center of the region. And so here on the right, there's a zoomed in view of where we see the hotspots in the St. Louis area. And if you're familiar with the St. Louis area, you'll notice that many of these hotspots are along major interstate highways, along in the intersections of major interstate highways. So, 64 and 70 here on the east. Here in kind of the northwest corner, we see kind of those intersections of 70, 170, and 270. And also down along Highway 64 towards the middle of the region. And then also another hotspot we saw down there. I think that may be, is that 64 and 270? But, in general, what we saw when we looked at our results is that we saw these hotspots that tracked along our highways in the region. The other thing I wanted to mention is that, as John mentioned in his talk, transportation, traffic-related pollutants were the largest source of air toxics in the region. So here we looked at the relationship between those demographics, that census level data, and some of the exposure to air toxics. And for all of the measures we looked at, we saw associations with air toxics. We saw our strongest associations with our variable for race, and our variable for income. So very high, strong associations between poverty and exposure to these air toxics, and Black race and exposure to these air toxics. So the mechanisms, the mechanisms between looking at these community level factors and exposure to traffic related air pollution, they're not well known, but what we think is happening is that for some of these disenfranchised communities, so these low-income populations, minority populations, they have fewer resources and limited social capital, so they don't really have the power to affect decision-making processes. And a lot of the policy decisions about where these highways were placed, I mean, these are decisions that were made decades ago, but some studies have shown that a lot of these highways in the mid 20th century, they were targeted towards low income and minority communities, partly because at the time they were placed there, they were the perfect targets for these areas because there was a lot of blight in these areas. So when deciding where we were going to place these highways and Eisenhower's highway program, often they would be placed in low income neighborhoods. And so what we think is happening is what we call this, we call it a cycle of vulnerability. You have these highways that are in low income neighborhoods. As a result, you have these decreased property values, which then in turn may be more attractive for low income residents to move into these neighborhoods because of lower property values. And then you have a community that is not as politically active, and the cycle continues. So this is what we think might be happening. And of course, these are events and policies that were made decades ago. So thinking about now, how do we reduce traffic-related air pollution? And some examples, and are very appropriate for this panel, is increase the fuel efficiency of motor vehicles. So we can go fully electric, we can go hybrid. There are other high mileage designs, but if you go fully electric, you're producing zero emissions. So those small pollutants, forming pollutants that are released from vehicle emissions, those pollutants that are harmful for human health, the greenhouse gases, they are zero. You could also look at hybrid vehicles, which they have a gasoline engine in addition to an electric motor, but they're much more efficient compared to the conventional vehicles that we see out there. So again, reducing emissions. Boosting public transit is a way we can reduce traffic-related air pollution. And then what's interesting, and we've seen this more on the coast, are this idea of multimodal streets. So streets that have bicycle lanes, that are pedestrian, jogger friendly. We've seen some cities that have closed off streets and made these streets, maybe for a weekend, a month, open public spaces for people. So just reducing the amount of traffic in general. So just to summarize what we found in our study, we saw associations between neighborhood, racial, and socio-demographic characteristics and exposure to air toxics. And this is not a St. Louis area phenomenon. We've seen this across the US and even across the world. And our largest source were these transportation-related pollutant sources. And so for us, what we're doing is we're looking at some of those hotspots, and our intention is to do some more air quality monitoring. Of course, working with the community to promote public transit. We're very interested in what will be happening hopefully in the next year or so with the influx of electric buses. And so we want to evaluate the impact of this new, more fuel efficient, zero emissions source of transportation. And of course, we've been working with communities in terms of thinking about some of the sources that they're seeing in the neighborhoods and ways we can support their work. So I wanted to thank my colleagues and some fantastic students who worked with me, and feel free to contact me via email, and you could follow me on Twitter if you have any more questions about my presentation and any of the work we're doing. Thank you. John, I think you're on mute.
Sorry about that. Thank you, Dr. Ekenga, and with no further ado, Dr. Slavin.
Thank you so much. I'm Dr. Raymond Slavin. I'm a longtime allergist immunologist at St. Louis University School of Medicine. 8 years ago, I formed an inner city asthma clinic on North Kings Highway in the Health Resource Center, formed by the medical school some years ago. I did it because I've had a long interest in asthma in general and in inner city asthma in particular. My interest stems in inner city asthma from the fact that asthma is more common and more severe in the inner city, and it's a disease that's treatable. Another word for a term for asthma is reversible obstructive airway disease. And so with appropriate environmental measures and medications, this disease can be treated and is reversible. I want to concentrate on children in this study. There is literally an epidemic of pediatric asthma. Childhood asthma has risen by 42% in the last 10 years. It's the most common cause of emergency room visits in children. It's the second most common cause of hospitalizations right after accidents. As far as asthma prevalence is concerned, in Missouri, childhood asthma is about 10%. In the city of St. Louis, it's 20%. So asthma is twice as common in the city of St. Louis as it is in the rest of the state. Looking at emergency room visits, 50% of all asthma ER visits are children. Childhood asthma visits to the emergency room for the state of Missouri is 8.8 per 1,000 population. In the city of St. Louis, it's 25 per 1,000. So it's 3 times more common than in the rest of the state. African-American kids account for 92% of all childhood asthma ER visits, and the ER visits in the state for African-American kids is 9 times the white rate. So why this disparity? Why is asthma so much more common and so much more severe in inner city children, particularly among African Americans? I'm not going to go into some of the obvious things like access to medical care, inability to see an allergist for appropriate testing, difficulty in payment for medications. So I want to concentrate on environmental matters. Certainly, the home is vitally important for a number of reasons in the inner city. Many homes do not have air conditioning, and so there's increased access to pollen and mold in the outside air. Frequently, water damage in homes result in mold growth. Parental smoking is higher in the inner city. And I might mention, as an aside, cockroaches. We participated in an NIH-sponsored inner city asthma study looking at why childhood deaths from asthma is so much higher in the inner city. There were 8 centers participating, and we found that one of the most important factors was cockroach. We analyzed homes for cockroach. We skin tested kids and found that it was a very important risk factor for emergency room visits and hospitalizations. I want to turn to the outside environment, leaving the home, which of course is very important. And of course, we're in a perfect area for pollens and mold. I want to concentrate on the ambient air in terms of smoke. As Dr. Ekenga mentioned, there's certainly an increase in asthma, in morbidity, in emergency room visits, hospitalizations among children living near highways. So I want to emphasize the rest of my talk on ground level pollution in the form of diesel exhaust fumes. It's a fascinating subject. There are 2 ways in which diesel exhaust fumes impact on asthma. First, they can trigger an asthma attack in children with asthma. We sometimes refer to asthma as hyperreactive airway disease, or the twitchy lung. So the lungs of an asthmatic is very sensitive to nonspecific irritants, cold air, secondhand smoke, and the fine particles in diesel exhaust fumes. So that in and of itself will trigger an asthma attack. But of fascinating information that's been gained in the last few years is that diesel exhaust fumes can actually cause asthma. These fine sooty particles contained in the diesel exhaust fumes will bypass the initial respiratory defense, and it'll lodge deep into the lung, and then they trigger an immune response, which causes inflammation. I don't want to get into a short course in immunology, but let me just say that there's very good evidence that the diesel exhaust fumes that are inhaled stimulate lymphocytes, particularly blood cells, and in particular a subpopulation of lymphocytes called Th2 cells. And these are the cells that orchestrate the allergic response. And they're found in people with asthma and with other allergic disorders. And there's very good evidence that these fumes increase the Th2 cells, which in turn lead to an increased response to common allergens like pollen and mold, and may explain why more and more children, particularly in the inner city, are developing allergies to commonly encountered agents like ragweed and mold and house dust mite and animal dander. Of course, there are many sources of diesel exhaust fumes, including trucks and locomotives, passenger cars, but I want to concentrate on school buses. Children will inhale air pollutants by buses that are idling at bus stops and schoolyards, but also exposure to diesel exhaust fumes inside the buses themselves. A study in California showed that the level of diesel exhaust fumes were 8 times the levels found in ambient air. So I think in closing, if we want to alleviate the asthma epidemic, we have to turn to decreasing exposure to pollutants. And I think an obvious approach would be to substitute electrical vehicles for the diesel buses now in operation. Thanks so much.
Okay, well, thank you, Dr. Slavin. And I want to pile on that point you just made about electric or about school buses, that is an issue that particularly impacts rural children who might have a 45-minute bus ride in the yellow school bus every day compared to kids in more metro areas. I know I had 2 kids who rode the yellow school bus to school, but they were going 5 minutes. It wasn't a big deal. But kids in rural parts of Missouri who might be on the bus for 30, 45 minutes, et cetera, they're going to have a worse public health, worse health impact than those urban kids. So I think it's a good example of how this issue of electrifying transportation is really a statewide issue. It's not just St. Louis and Kansas City issue.
Yeah, a very good point. I was concentrating on the inner city, but rural areas are just as important, if not more so. I might mention it's the rural areas that are losing the hospitals. I mean, as bad as things are, if you're in the city, you're literally a few minutes to a hospital. But in the rural areas, it's a very sad situation.
And if I think another aspect that is relevant to what Dr. Ekenga was talking about is looking at railroads. And if I'm correct, and if there's somebody from Bi-State that can correct me via the chat box if I'm wrong, my understanding is Bi-State also has a role in managing the train yards in the central corridor of St. Louis. And within those train yards, my understanding is you have what's called switching locomotives that don't go for long distances, but just move around the cars in the trail yard, and that those are diesel. And so that's another area that if you look at, since it's right along the Highway 40 corridor, it's lines up with the red areas on Dr. Ekenga's map. And that is an area where there's real opportunities. It's easier to electrify a switching locomotive that stays in the train yard than it is to electrify a locomotive that's going from St. Louis to Wyoming, let's say. And there's actually a business in the Metro Kansas City area, Orange EV, that builds electric switching locomotives. So there is an industry already building up there, and so there is options for people who are operating train yards. And I'd like to turn the tables here and ask a question to our participants. If there's anybody who's on this Zoom right now who is acquainted with what their transit agency is doing in terms of electric buses, I would ask them to put that in the chat box, whether that's talking about when you're going to have buses delivered, if you've got them on order. If you do have them deployed, what is your experience? What's the upside? What's the downside? What should other transit professionals here in Missouri know? So again, I would invite comments from our participants. I know from my presentation that many of the transit agencies around the state are moving towards electric, but I'm interested to see, do we have real information? And I'm thinking in particular of Columbia, because I think that transit agency is the one that's furthest along in actually having buses rolling on the street. Okay, well, we may not have Columbia folks on board. And if we have somebody from bi-state who's acquainted with the process at the Brentwood Bus Garage and can inform us how that project is going and to prepare for the delivery of vehicles here to bi-state, I'd ask them to use the chat box to bring us up to date as well.
So John, I'm not sure if we have anyone with bi-state right now, but I do know that Springfield does have buses on the way, but they've been delayed until April of 2021. I know that the pandemic is impacting the delivery of vehicles in a lot of our newer vehicles in a lot of our markets, including the electric buses. I did want to talk a little bit about this and hear from Dr. Ekenga and others. You know, we have these transit providers across the state that are beginning to add electric buses to their fleet or are growing their electric bus fleet. And is there an opportunity there for providers to actually work with the research side, whether it's the Brown School or others across Missouri, to really try to quantify and qualify the impacts of going electric in our Missouri communities?
Absolutely. I know myself and our colleagues at the School of Engineering at Washington University, we will be it would be more than welcome. Please, you can contact me. I can share my email perhaps after the chat and we can discuss more. But I know that if not at the Brown School, we have colleagues at the School of Engineering who are very interested in improving the air quality in the region.
Thank you.
Now, I'm not a researcher, but one suggestion I would make is my understanding is that bi-state, when it gets the delivery of these 14 electric vehicles, is instead of sprinkling those buses over a variety of routes, is going to have all the electric buses run the grand route, the number 70 bus. And it occurs to me that might be an opportunity for sort of a before and after research to see whether the switch to electric makes anything a measurable difference in air quality. Because the thing about transit buses, when you think about it, is you want to run the bus through the most densely populated area with the lowest level of personal vehicle ownership. So, and also probably the lowest level of health insurance coverage. So in some ways, where diesel buses pollute is very much lines up with race and income, as Dr. Ekenga found, and so it makes it a even more beneficial place to invest money because the impact is so concentrated.
John, when you mentioned Grant, did you mean Grand Boulevard, where the buses will be running?
Yeah, Grand Boulevard is what I meant to say.
Mm-hmm. Mm-hmm. Right by St. Louis U Medical School.
Right, so it helps the people at the medical school too, so it's a twofer.
Mm-hmm.
So John, do you want to talk a little bit about, David Johnson has put in the chat box talking about Missouri's VW program and how that was potentially a huge missed opportunity. I know a couple of our transit providers were actually able to leverage some VW monies to add to their electric bus fleet, including Go Como. But do you want to talk a little bit about the VW settlement and, you know, was it a missed opportunity? What else is available for transit providers? What other funding pots are out there besides normal DOT funding to maybe look at adding these new technologies to their fleets?
Yeah, I know some transit agencies were successfully able to get VW settlement money for electric transit buses. a big chunk of the VW settlement money in Missouri also went to replace old diesel engine on school buses, especially in rural districts, as we just discussed, although the challenge was that the money was used to buy cleaner or more up-to-date diesel engines, but diesel engines nonetheless. So I think that's an improvement in air quality for those kids on those buses, but it's only half of a solution. It's not the full solution. So I think that was a missed opportunity. But I think I know the federal government in the past has made funds available, and I believe that the bi-state here in St. Louis has used both VW settlement money and Federal Transportation Administration money to buy the buses. They also use some funds, I believe, from Ameren Electric. And so what I've seen is that transit agencies have had to cobble together a couple of different pots of money to come up with the purchase price for the bus. And that I think that is an ongoing problem, because while the bus is cheaper, an electric bus is cheaper to operate over the lifespan of a bus than a diesel bus is, the upfront cost is higher. So if you're running on a very tight budget, it's hard for a transit authority to make those investments that may pencil out in the 10-year period, because you got to pay for the bus on the front end. And so I think that's an ongoing challenge, and hopefully we'll see a more aggressive posture from the federal government to invest in this, in helping local transit agencies purchase these electric buses. And I think one thing that's another aspect of that is, as you see the electric bus market grow in the United States, you're seeing more manufacturing of electric buses in the United States. And I believe actually the buses that the bi-state, I think, is buying from New Flyers, I think is the name of the company they're using, which has plants, I think, in Minnesota, Ontario, and maybe Alabama. And so we're seeing more of that construction happening domestically, which also then has additional economic benefits for the country.
John, you
So
mentioned,
I do want to mention, go ahead, Dr. Slavin.
the cost of the bus. For somebody totally naive about this, what about I guess you'd call them charging stations? Is that a big expense, having the facility on site to charge the buses?
My understanding is that that substation built at the Brentwood Bus Garage here in St. Louis was about $1 million project. And again, if there's somebody from Ameren or bi-state that's actually got a better number than that, please add it to the chat box. But I believe it was about $1 million. But the good thing is Ameren paid that $1 million. Bi-state didn't pay the $1 million, Ameren did. And one of the reasons is Ameren then is locking in sales for 10 or 20 years. It is in their interest, because it is building market share. And so I think you'll see electric utilities around the country looking at electrifying transportation as their lifeline to deal with the drop in sales of electricity due to the improved energy efficiency across the economy.
Thank you.
And just to add to that, the reason that it's important, and somebody from Ameren was explaining this to me, that when you have an electric bus system, you need to have a redundant electricity supply in your bus garage. Because if, I don't know, a tree falls over and knocks out your electricity, you can't then say, well, the grand bus isn't running today because we have an electrical problem. You have to have multiple systems. So if one goes down, you still have enough working plugins that you can keep your buses rolling. So that is an And right now, current bus garages aren't going to have that level of redundant supply because they don't need it, but they do need it to have the reliability for keeping the electric buses rolling. But again, Ameren, my understanding is Ameren paid that $1 million. So for people who are on the call thinking, I'm a public transit agency, where do I come up with $1 million? Well, talk to your utility. They might be interested because for them, it could be a smart business decision.
Hmm.
And one other thing I'll add that I didn't put on the potential allies, but I think is a group to look at is bus drivers. Who sits on the bus longer every day than just about any bus rider? Well, the bus driver, because he or she is in the bus driving for a whole shift. And so when you look at the how much of that diesel exhaust you're breathing, bus drivers are going to be one of the groups that's really going to breathe a lot of that. And so, for example, your bus drivers union might be a real ally in promoting electric buses because it improves the health of those drivers, perhaps even more so than the passengers themselves.
You've given me an idea for a new research project, John. Looking at pulmonary function in bus drivers. Yeah.
That's a great one. And Amalgamated Transit Union Local 788 represents bi-state drivers, great local. And it's a union actually nationally that's been very engaged on the issue of climate change because of all the collection of issues we've just been talking about in this last hour. Oh, and the one closing comment I'll make is that I know bi-state borrowed 2 electric buses to test drive them in St. Louis back in, I think that a year and a half ago, January, because one of the challenges or one of the concerns for the transit agency was electric buses are fine on a day that's 70 degrees and pleasant, but does the battery have enough power to keep the bus heated when it's 10 degrees or cool when it's 100 degrees? And that has been a challenge. And that's one reason why, if you look at electric bus adoption, that it started in more temperate parts of the United States where there's not the same temperature fluctuations. And so I know colleagues from bi-state have said to me that, hey, it's one thing to have an electric bus if you're in San Diego, but San Diego ain't St. Louis. And now the test that bi-state has done is they are confident that actually the battery capacity is now improved to the point that it can provide adequate air conditioning in the summer and adequate heat in the winter and still run a long enough route to make the whole system work. And so anybody on the call who might be thinking, well, you know, Missouri's got too much temperature fluctuation, this isn't realistic here yet. And bi-state's tests showed that, in fact, bus technology has improved. And this is changing very quickly because 3-4 years ago, bi-state's position was batteries aren't good enough. And now they've seen that technological change is really moving fast. And not just obviously in electric buses, but electric cars and a lot of other applications. But it really is a new day. And I think that's going to mean much more rapid adoption of electric buses across the country.
Mm-hmm. Mm-hmm.
I want to take a moment and thank John and Dr. Slavin and Dr. Ekenga for joining us this afternoon. There are some really great comments in the chat box, especially from David Johnson on what they're doing in Kansas City, as well as what Oates and SMTS did when they participated in a pilot project. So I suggest that attendees look at the chat box as well for other examples of what is happening in Missouri's public transit system. Again, I want to thank you for your time, and this workshop has been recorded, so we will be posting it on the MPTA website in the next several days so that people have this as a resource as well. And I highly recommend that transit providers, if you're interested, you consider reaching out to Dr. Ekenga or Dr. Slavin or others to be a part of some of this research moving forward. I do think that these electric vehicles could have a significant impact on our communities in Missouri, and it would be great if we could actually be a part of that research instead of just on the outside looking in. So I highly recommend that. And again, thank you to all of you for joining us today.
Thank you, Kim. Thanks, everybody.
Thank you. Have a good afternoon.